Thank you, Chris. Well, in Health Matters this morning, March is Colorectal Cancer Awareness Month. And next Friday, March 7th, is National Colon Cancer Screening Day. Dr. Jit is from Digestive Specialists and joins us this morning about the third deadliest form of cancer. And good morning, Dr. Jit. How are you this morning?
Good morning, Hilary.
Good.
I'm fine.
Now, normally Mike or Megan would do this interview, but I'm doing it today because this is very personal to me. I was diagnosed with Crohn's disease when I was 15 years old, which is an autoimmune disease in my colon. And it's really, really hard sometimes to live with it, but it's great to have you in this morning to talk about the importance of living a healthy life to prevent diseases like that and like colon cancer. And what we want to start with first is sometimes there are no symptoms, right?
Yeah, actually most of the patients do not have any symptoms who develop colon cancer. So it is very important to have screening colonoscopy done. Some patients can have symptoms, but like I said, most of them do not have any symptoms.
And some people can get really scared of having those colonoscopies. I, for one, have had about 4 in my life so far. I get one every 2 years, and the prep is scary sometimes, but there are different forms of the prep nowadays.
Well, the good news, Hilary, is that we do have better preps now. At Digestive Specialists, we use a lot of low volume preps, so you don't have to drink that gallon jug of medication to clean out. And we have these low volume preps that are much easier to use.
Okay, and what are the risk factors here? That's our second thing we want to talk about.
Well, age is the biggest risk factor. So above the age of 50 is when most of the colon cancers are found. Other risk factors are your lifestyle habits. High fat diet, low residue or low fiber diet is a risk factor. And smoking is definitely also a risk factor.
And of course, some genetic diseases like Crohn's disease is always a worry in the back of my head that colon cancer is in my future. But of course, getting those colonoscopies is so important. I heard from a doctor once that it's hard for him to tell his patients that they have cancer, but it's even harder to tell them that what they could have done earlier in their life could have saved their life. Talk about some things we can do right now to make sure we don't get this form of cancer.
The lifestyle changes like we talked about, low fat diet, high fiber diet, avoiding processed meats and red meats is very important. Stopping smoking is extremely important to prevent colon cancer. And then having a screening colonoscopy done. And like you said, screening colonoscopy can save lives.
Okay. And of course, what we eat, really important. Those fried foods, those processed foods, never good for our colon. Also, it's treatable and can be cured. Now, you have 5 locations in the Miami Valley all over the place, so people can give you a call if they want to get that screening. Exactly.
It's very easy to schedule. We have 5 locations all over the Miami Valley area, starting from Springboro to Huber Heights, Beaver Creek, Kettering, and Dayton. And all you have to do is call us and schedule a screening colonoscopy and help prevent colon cancer.
All right, Dr. Jit, thank you so much for coming in this morning. Such an important issue. And for more on colorectal cancer, log on to abc22now.com. Just click on Health Matters. Chris, we will send it over to you.